Welcome to the Deep Dive, where we cut through the noise to get to the core of the science. Today we're tackling something so many of you have asked about: tendinopathy. We're going to get into the why it hurts, the foundational physiology based on the research you sent over. So let's start at the very beginning, the building blocks. The sources point to collagen fibers as the primary material.
Right.
And you can almost picture them as these high-tension cables, right?
Right.
Their whole job is just to transfer force from muscle to bone.
Exactly. They do the heavy lifting. But if the collagen is the cable, then you have to ask what lets those cables move.
Okay.
And that's this other critical component, the intravesicular fluid, the IFM.
IFM.
Yeah. And what's fascinating here is that the IFM is basically the lubricant. It's absolutely essential for those collagen fibers to slide and glide past each other smoothly.
So without that, there's no healthy movement.
You've got it. No glide, no healthy tendon.
All right, so let's get into the mechanism. How do we go from that healthy gliding to, searing pain? The sources all point to one initiating event: acute overload.
That's the trigger.
And this is where it gets really specific, because the tendon doesn't just, snap. The first response is actually chemical.
That's right. It's a defense mechanism. When you subject the tendon to that acute overload, like say you suddenly double your training volume, the IFM, that fluid, it doesn't just sit there.
It reacts.
It reacts. It sort of sees it as an emergency and starts producing these substances called proteoglycans.
Proteoglycans. Okay, and what do they do?
Well, think of them as microscopic sponges. They are extremely hydrophilic, which is just a fancy way of saying they love water.
So they just soak it up.
They aggressively pull in water from all the surrounding tissue, and that combination, the proteoglycans plus the water, causes a very rapid, very localized swelling right in that spot.
So the body is essentially trying to protect the area by swelling it up. That seems so counterintuitive.
It does, but that's what's happening. It's this very contained internal water retention.
And that's the link to the pain. That swelling, that pressure starts to irritate all the little nerve endings in the area.
Exactly. The sources are really clear on this. The searing pain you feel isn't from a tear, not initially. It's from the physical pressure of that fluid irritating the nerves.
It's a mechanical pressure problem.
A chemical mechanical pressure problem. That's a perfect way to put it.
So if that's the cause, what do we do about it? How do we manage this cascade?
Right. So moving into initial management, since the problem is mechanical irritation, the goal has to be calming everything down.
Calming the nerves.
And normalizing that fluid environment. The sources recommend two main things to start: rest, usually for about 2 to 3 weeks, and combining that with isometric exercises.
Okay, and the why for the isometrics is pretty important here, isn't it? It's not just about sitting still.
Absolutely not. The beauty of an isometric, just holding a position without movement, is that you can still apply some load to the area.
Which you need for healing.
Exactly. You stimulate healing, you maintain strength, but you do it without any of that dynamic sliding and gliding that's just going to further irritate that swollen, sensitive area.
To get the benefits of loading without the cost of friction.
Precisely. You calm the nerves while still reminding the tendon how to work.
So the big takeaway here is really powerful. Tendinopathy pain isn't just a simple tear. It's this complex, localized chemical defense that goes a little haywire, causing swelling that presses on nerves.
It all comes back to that fluid chemistry.
It changes everything.
It really does. And it leads to a final thought for you to consider. If that acute overload is the trigger, if that's the spark that lights this whole painful fire, then how absolutely crucial is it to carefully regulate the intensity and volume in your training? This knowledge completely changes how you should approach loading and preventing this from ever happening again.